Our next set of speakers will be just a few of the many telemedicine services being offered to patients across the country today. We'll begin with Howard Rochay, Vice President of the System Operations at Howard.
Good afternoon, everyone, and thank you for the opportunity to present at this forum. I'm going to share two things quickly with you from a Florida Blue perspective. The first is our position on public policy to telemedicine and where we're at in that space. And then second of all, I'm going to share some of the work underway in the telemedicine space that we currently have activities in. As a means of introduction, I do want to start out by saying, hold on, I got to get the slides to move. My apologies there. Florida Blue understands and agrees that telemedicine is a growing alternative to traditional health care. We believe an opportunity to improve patient access to health care, reduce medical costs through reduction of higher cost services, and to improve member satisfaction as well as quality of care. We support the expansion of telehealth services to enhance, specifically for us, Floridians' access to convenient, affordable, higher quality health care. From a policy position, we support relaxing or at least revisiting legislative and industry barriers which could inhibit the maturation of telehealth capabilities, where doing so improves quality care and affordability. Florida Blue supports the free market approach for telehealth services, whereby payers, vendors, others in the space negotiate reimbursement and coverage terms consistent with market and customer expectations. We do, of course, or support legislation or industry actions that would mandate payment amounts, mandate member benefits, specific network participation for telehealth services. We believe a good public policy should have the following objectives. It should address access and increase access to care, increase quality for both clinical and service-related activities, have the potential at least to decrease costs or at least not increase costs, and allow the free market to work as it does today, or enhance the ability for it to work. We also believe, as mentioned earlier, that it should support the industry's move to value-based reimbursement, where we are moving to pay for value versus pay for service, and it should not restrict the market in any way. From a strategic position internally, from a telemedicine standpoint, we support a member benefit approach aligned to a dedicated vendor-managed sub-network of providers. In the very near future, self-funded account business with Florida Blue will have the option of purchasing telemedicine benefits through the Florida Blue relationship with Teladoc. This is a recent contract relationship that we're moving forward with. I'm going to speak more about that later in the presentation. From a telemonitoring standpoint, we do support telemonitoring as a care management program where services are valuable for specific high-risk members who will benefit from the program, reducing need for higher cost services and increasing quality of life and quality of care for those members. We do not necessarily support broad telemonitoring as general benefits under all products. So from a strategic approach internally, we are introducing several select capabilities as part of our overall telehealth strategy. Our goal is to pilot test the quantitative and qualitative effectiveness of those solutions. As everyone knows, this is an emerging space, a lot of activity, so our plan is to scale up and integrate the most beneficial and cost-effective telehealth capabilities as we learn more about them and as the industry continues to mature. So what are we currently working on? We have three activities that I'm going to share with you specifically, and then I'll talk about some future things that we're also considering. The first activity is a kiosk in the Miami Retail Center. Florida Blue has a variety of retail centers throughout the state of Florida. We have chosen to put a telehealth kiosk in the Florida Miami Retail Center. This was put in October of 2019. Treatment offered there is for convenient care for Blue members only at this point, to treat things like cold, flu, allergies, earaches, other convenient care type activities. The network behind the kiosk is Nicholas Children's Hospital, previously known as Miami Children's Hospital. So this is the provider that provide services for the kiosk. And you can see our hours of operation there. Early evaluation, we did expect a little more traffic than we're currently getting. We continue to monitor the effectiveness of the members seen at the kiosk and the effectiveness of the services rendered there. And we'll obviously evaluate the results of the pilot in the near future, giving it enough time to show effectiveness. And at that point, we'll make decisions on whether or not we move forward with kiosk in other retail centers or not. The second thing that we have active, I mentioned earlier, we have entered into a contractual relationship with Teladoc so that we can utilize their services to offer telemedicine benefits to our ASO clients. That ASO is just an acronym for self-funded clients, to purchase as a buy-up benefit. And this is administered through a sub-network of providers. This is not tied to our general network. Sub-network of providers is contracted through Teladoc. Our target effect is third quarter 2015. The third thing that we're looking at is telemonitoring. As I mentioned earlier, we believe telemonitoring is a viable solution as a care management opportunity for select members who have chronic care issues or have issues related to their health care. So we are finalizing a RFP to pilot telemonitoring program. Our initial target will be members with congestive heart failure. So these high-risk members will be identified and offered the opportunity to participate in this program based on several factors related to their health. The initial group will be for fully insured high-risk members with the the CHF diagnosis, and our target effective date there is third quarter of 2015. If the pilot goes as expected, we will continue the rollout of this activity to other disease states and potentially other members. While not mentioned here, we also are engaged in a few other activities. We are evaluating what we classify as this came to us, and it's a very recent evolution in the market where there's several vendors. You'll hear from one, TouchCare, in a few minutes, that are looking at ways to providers to their own patients through different capabilities. So Florida Blue is evaluating those capabilities and the potential that might be in that space as well. So in summary, just to reiterate, we do support telehealth services and are excited about what they're bringing to our industry. We specifically are looking for opportunities to advance Floridians' access to convenient, affordable health care. And again, relaxing those legislative and industry barriers that may exist out there that could inhibit the maturity of the telehealth industry. Supporting the free market approach, trying to stay away from legislative or industry actions that would mandate fits all across the nation. We do believe there's some flexibility and variability that needs to be considered. And then we are very excited introducing several initiatives, piloting initiatives, testing them, moving forward with the best-in-class solutions, and then continuing to see what the industry brings in this space. So that's the end of my presentation. So again, I'd like to thank Catherine and others for the opportunity to speak today, and I'll turn it back over to the